It's Dr. Stan. It's Monday. Happy Monday. What a good day it was. And what I wanted to talk to you about today was our adjustment. So a lot of times when people go to, say, another provider of some sort, medical doctor, physical therapist, and they mention going to a chiropractor. And the first thing that pops into the person's head when they go to the chiropractor is the traditional type of chiropractic where you see where they crack the neck or back, or they roll them aside and push the low back, and they don't really understand what we do. And even patients that we've had for a long time, with our adjustment being so light, they don't understand what we do either. They think, well, how can the adjustment being so light actually do anything? It's a really good question. And when it comes to chiropractic, say there's a group of people, they're going to go to a chiropractor. Now this group over here, this tiny little group, they can walk into any office, you could smack them in the butt with a snow shovel, their body will get better. It just needs a little bit of attention. And yet this group here in the middle, and this is where chiropractic has thrived for 129 years, since 1895. The body needs something a little more specific. It's gone off to the right, needs pushed back to the left, and great things happen. But then you have this group over here, and that's where we are. Their body needs something a little more specific. It's gone off to the right 1.5 degrees, it's gone back 3/4 of a degree, and it needs corrected along that path for the body to do what it needs to do, to remove the interference from the body, to allow the brain to communicate with the body how it's designed to communicate. And if we push too hard on this area up here, your body really wants to protect this. So if we push too hard, the muscles tense up, the joints lock up, it makes it really difficult to move things. And so if we set your head up just right, and we've calculated from the x-rays the angle that we need to use, and we set you up just right, we set ourselves up just right to be in the right angle, we shouldn't have to dent the skin more than 1/8 of an inch. If we dent the skin more than 1/8 of an inch, if we put too much pressure, then everything just tightens up. But if we just put just enough pressure to get things moving just a little bit, if we have your head set up the right way, then gravity takes over and your body will shift and change things. And we know decently well where your body is supposed to be, but your body knows a heck of a lot better exactly where it's supposed to be. So then it starts shifting and changing and moving things to put it where it's supposed to be. So that's why we don't have to force things into place. That's why we don't have to crack things or twist things. And we just use math and engineering and leverage to get your head on straight and allow your body to function how it's designed to function. It is really that simple. And so if you have any questions, feel free to click on the link, contact us, email me, drstan@myamazingspine.com, and we'll be happy to answer your questions. I hope you guys have a wonderful day, and we'll talk later. Bye-bye.